Hi, I'm Peter Roper. This is another serving of Potluck Politics, and we're going to talk about a topic that's hot in the news right now, healthcare. We're going to talk about the difference between Obamacare and Trumpcare, the new version of healthcare that's being discussed in Congress and in the newspaper. We have two experts to talk to us about this issue. Dr. Eugene Winchester, thank you for joining us.
Thank you for having me.
And Maria Petrillo, who actually is involved with Rise. You're both involved with Rise Up Mystic.
Yes.
And both have been involved in the healthcare group, I understand, and you were actually the chairman of that group.
Yes.
Good. I guess your background is pretty professional on this issue, so I'll give you a little bit of that. You've worked at Hartford Hospital, and you're medical director of Aetna, and you're a senior consultant for Mercer and chief of staff at Wyndham Hospital. So you come well prepared for this topic, I would say. And Maria, you have a background as a graduate of Roger Williams University.
Yes.
You have a BA in history and a minor in art history and visual arts. And you went to the Naval Maritime History at the University of Exeter. Mm-hmm. And you're now working for Medicaid.
I am.
So if I missed anything, fill that in now. But we really appreciate you coming and talking about this issue. Maria, could you at least start off by talking about Rise Up Mystic briefly? We did do a program about Rise Up Mystic, so if people are watching these, they may know it a little bit, but you should summarize a little bit what the group is.
Yeah, so Rise Up Mystic is a progressive action group. We're pretty focused on a lot of different progressive issues in Connecticut and nationally. Generally, we like to say it's not an anti-Trump group because progressive issues matter even if Trump is not reelected or even if he wasn't president. So we focus on a wide range of issues from healthcare, which is our group, but also climate change, environmental issues, social issues. We have a women's rights group and growing.
Yep. And you've actually done quite a bit on immigrants and the ban on Muslims.
Yes, we did do. Yeah.
So it's a wide-ranging group and pretty enthusiastic from what I've seen. We actually are members and have been involved a little bit, so we know a little bit about it. Thank you. We've got a lot to talk about because obviously healthcare is complicated, as Donald Trump helped us explain to us, as if we didn't know that. So let's get started. Dr. Winchester, could you tell us a little bit about the American medical scene before Obamacare and which is known as the Affordable Care Act? I should use its correct name, I guess, but Obamacare has become the name of it. And just talk, how Obamacare changed what was happening at that time.
Healthcare initiatives go back more than 100 years to the time of Teddy Roosevelt. And successive administrations have tried to address the growing inequality and lack of access and affordability. And there were many opportunities that were lost. Franklin Roosevelt died while he was in office. He was planning to have a healthcare policy when the Second World War ended. Harry Truman wanted to do it. Lyndon Johnson, when he initiated Medicare, that was just part of a multi-phase program, and then
which is excellent and very successful. So that was a good thing.
And the Vietnam War got in the way, and it just goes on and on to every administration. And the Clintons obviously did not succeed. Barack Obama did succeed in bringing together the various, very disparate and often warring interest groups. Obamacare certainly had problems. But most social programs, when they start, have problems.
It is complicated. There's no question. It is complicated.
Medicare only covered 80% of inpatient events. Social Security excluded people who worked in the home, excluded agricultural workers, and so on. So in every iteration, there's a need for improvement. Unfortunately, Obamacare was cast as just a terrible and evil thing that needed to be repealed and replaced. But to get back to your original question, before Obamacare, there were pre-existing condition exclusions. Even a minor condition could make health care unaffordable. There were lifetime caps of typically $500,000 to $1 million. Kids would lose their parents' coverage at age 21. And healthcare was really very fragmented and unequally distributed. So Obamacare tried to address most of the issues and was largely successful in addressing most of the issues, particularly the lifetime caps and pre-existing condition. The small and individual market was considerably reformed.
Since you know about Medicaid, it did affect Medicaid too, because that was the biggest chunk of people, I think. Who
Absolutely. Obamacare had a huge effect on Medicaid, mostly through Medicaid expansion. There were a lot of things that Obamacare did for Medicaid, but the most obvious is the expansion of coverage. Initially intended to be for all 50 states, but then the Supreme Court ruling allowed certain states to opt out of it. So not all states have implemented Medicaid expansion, but nationally, about 14 million people are covered under Medicaid expansion. And what that did was it changed the eligibility rules. So previously, Medicaid generally only covered children, parents, pregnant women, elders, and people with disabilities. And Medicaid expansion basically said, as long as you're under a certain poverty level, you can be covered by Medicaid. So that was obviously a huge change in the way the program was run.
These things you've described about what Obamacare did all seem pretty positive, and yet it was treated badly from the very beginning, and I don't think it was marketed as well as it could have been. People didn't know what it was until they actually got it, and then they realized, oh, it's not so bad after all. But why do they think it was so bad and broken that they needed Donald Trump to fix it? That's one of the things they hired him for.
Well, in any sort of transformation, there are winners and losers. And much of the public discourse has focused on the individual exchange market, which only is about 5 or 8% of the total pool of insured. So that's not to say that it's inconsequential, but it took up a disproportionate part of the conversation. As Maria said, there were 14 million winners in Medicaid. The problem with the individual market was for any type of insurance to work, most people need to pay in but not receive benefits, or to pay in more than they receive in benefits, whether it's auto insurance or house insurance.
That's how insurance works.
Yeah, so that on the off chance that something terrible happens, the insurance company can pay that high cost claim. So it was underfunded to begin with. It recruited a lot of sick people who had done without health insurance for many years, so there was a pent-up need.
Right.
And because parts of the original package was dismantled, as Maria said, because of some Supreme Court decisions, the corporate mandate was indefinitely postponed. The individual mandate has now been blown up. All of the things that the Republican leadership has been concerned about in terms of a death spiral becomes a self-fulfilling prophecy, that young people who are no longer obligated to get coverage opt out, feeling that they're invincible, and the sort of people who buy coverage end up spending a great deal more than they pay in.
So the main complaints about Obamacare were the mandate for individuals.
Well, individuals don't like to be told by the government what to do.
And let's not forget, health insurance premiums were always going up year after year. It wasn't until everybody had to buy them that it became a bigger issue, because in the past you could say, no, I don't want to pay for this, and kind of roll the dice and hope that nothing happened. Whereas, when you are now having the individual mandate, if you don't get coverage, you get tax deduction. No, other way. They take money out.
You get a tax, yeah. And this was all based on a Republican plan, which is interesting that the Republicans hated it so much, because it was Romney's
Yeah.
this plan that they based it on, and I know Obama did a lot of things to include insurance and include people that before had traditionally opposed any kind of health care reform.
Sure,
And yet the Republicans made it their cause célèbre from the beginning.
it's based on a commercial coverage model, which is very much a Romneycare.
It was the Heritage Foundation that wrote the blueprint.
Yeah. So many of the things that they're trying to eliminate are going to make it not work. And then they're saying it's not working already. So could one of you or both of you talk about Trumpcare and you know, what that means? They call it the American Health Care Act, or repeal and wreck as I call it. But it's just passed through the House of Representatives on second time. The first time they couldn't even get a vote, so it has passed. And now it's before the Senate. You want to talk about that a little bit?
Would you like
either
to
or
take
both?
the Medicaid
Sure.
portion? Because that includes by far the largest number.
Yeah, so the American Health Care Act does two things to Medicaid. The first thing it does is it sunsets Medicaid expansion, so that program will end, or at least the federal participation will end. So the way Medicaid is funded is it's usually roughly 50-50. For every dollar that a state spends, the federal government kicks in another dollar. And Medicaid expansion is unique in that it's 100% federally funded. So by taking that money out, you're basically eliminating the program. States can try and find ways to make up that difference, but in Connecticut alone, I think it's close to $1 billion in funding. And you know, we already have a pretty cash-strapped government. That's going to be a lot of money to find. So it sunsets that program basically by saying that if you lose coverage for more than a month, you're not eligible to re-enroll. And Medicaid eligibility is pretty volatile, so that's pretty likely that most people will lose coverage at some point or another.
So if your employment changes, then you may lose your health care, and you can't get it back.
Exactly. As soon as you lose it, you can't get it back. The other thing it proposes to do, and this was also in Trump's budget, is change the way that 50-50 match works. So it's open-ended right now. You'll hear that a lot. It means that, you know, as long as the state gets the okay from the federal government, they can cover different populations and different services, and the federal government will keep matching that. The new budget says that it's going to either be a cap, so a cap per member, fixed dollar amount, or it could be a block grant. So a fixed dollar amount means that you only get a certain amount of money per person, and it's based on your current enrollment. So if enrollment changes, if the economy has a downturn again and there's more people on Medicaid, you don't get that money back. It's also not usually adjusted well for inflation. So that means as costs go up, the match won't meet that need and won't grow at the same rate. And then the block grant basically means that they give a chunk of money to the state. The state has more flexibility to spend it, but again, that money doesn't change. It's the same block grant all the time. So if costs increase or enrollment increases, you don't get any more money to take care of those people.
So as we're coming over here, the CBO has released information about the cost of this new version of healthcare, and it sounds like 23 million people are probably going to lose insurance. I assume a lot of those are going to be in Medicaid?
Yes. So
because of what you just described.
Yeah, 12 million of expansion. States will also have a decision to make. You know, they can cut benefits, they can cut enrollment, or they can cut, services programs. So it'll depend. Most states have a hierarchy of what gets cut first. So like optional benefits, things that you don't have to cover, followed by certain populations, and then finally the mandatory benefits.
And that's only a piece of it. The regular insurance and individual is going to be affected big time by this too.
It's important not to stovepipe the benefits because they all interlock. So if reimbursement goes down for hospitals for the Medicaid population, then everyone who requires hospital care is going to be impacted. And there are still parts of the Trump-Ryan care. Trump is not really taking full responsibility for it, so it's mostly the Ryan plan.
Right.
That still need to be fleshed out in the marketplace. So part of the discussion is that pre-existing conditions will still be honored, but they may be shunted into the high-risk pool, which have been a uniform disaster across the states. They're underfunded, and 1% of the commercial population consumes 20% of healthcare dollars. 5% consume 50% of healthcare dollars. So if you try to segregate those, then those people will have to pay ever-increasing premiums. The ones who can't afford it are, who knows what's going to happen to them. The grants for helping people cover in the individual market, which were income-based, so that even though premiums were going up, half the population was shielded from it because their income was below a certain amount. Now it's going to be $2,000 for a younger individual, $4,000 for up to 65. And that's going to be totally inadequate. Some of those premiums in some of the higher cost states, between premiums, deductibles, co-insurance, et cetera, could be more than $20,000 or $24,000. So the numbers simply don't add up. There's also discussion about getting rid of the essential health package, which mandates that in order to qualify for insurance, and a policy has to cover certain things that are really intuitively obvious, like emergency department, on medications, inpatient care, and so on. Now it's likely to be a la carte, so that men will no longer have to sign up for maternity coverage. Well, children come out of some sort of cooperation between men and women. So that may result in much lower premiums for
those men.
single young guys,
Yeah.
but a disproportionate burden on women. And the whole thing with covering women's health and Planned Parenthood defunding and so on, it all ties into that package where some people will be set against other people. There's also discussion, and we don't want to have to go too far into the weeds, of having insurance across state lines, but that will create a battle for which states permit the skinniest coverage at the lowest cost.
Yeah.
And again, it'll be adverse selection.
Yeah. They do keep talking about how giving states the ability to decide what they want, but that's kind of code for allowing them to give us a less of a program than what we need. So.
And the presumption is that they'll have to pay for anything else. And as Maria said, pretty much all the states are tapped out at this point.
Yeah. One thing I always like to point out is, people who don't have health care, they're going to hit the system at some point. You don't get your primary care visits. A lot of people will wait till they're on Medicare, and then Medicare costs go up. Or you become sick, and then you become Medicaid eligible because you've spent down your money, or you've had a catastrophic event. So, just not paying for it in the upfront doesn't mean that costs go down overall. It means that costs spike when you have a major event, major health problem.
Yeah.
Well, that's a very important point. I'm an emergency physician, so I would see people who couldn't afford to take their medications and then would have to be hospitalized. Whether it's for diabetes or asthma or heart condition. So in the end, everybody ends up paying more.
Yeah. So many of the people who wanted better health care and were upset because they thought Obamacare was bad are probably going to get even worse care and maybe more expensive care in the long run. So what do you say about the criticism, I guess, that Obamacare is imploding? And I know we talked a little bit about that some of the reasons it's imploding is because they've sort of taken away the reason that it's funded.
Yeah, it's all a question of funding things adequately, and politicians have a habit of always promising more than they can deliver, or kicking the can down the road in terms of expenses. As originally structured, the numbers probably made sense. Both short-term and, as Maria said, longer-term in terms of saving the country money and focusing on preventive health and initiatives to improve the quality of care in hospitals and so on. So it held a lot of promise, but it was always underfunded because of Republican opposition, and even more so, including holding back on subsidies to insurance companies. Not that they're anybody's favorite.
Yeah, but that made it work.
But a certain amount of money has
to grease the wheels. And then they drop out and don't provide insurance, and now the Republicans criticize that, which is partly their fault.
So the stress is largely self-imposed because of ongoing hostility to Obamacare.
All right. Maybe you should both talk about what's happening now, because the House did pass this version, and now the Senate has it. And we're not hearing a lot about what's going on, but I did hear that the Democrats are not in the loop, that Republicans are working on it on their own. And I don't think they're going to be just adopting it the way it is. I think there are going to be some changes. Do you have any ideas of what they might be looking at and what kind of a plan is going to come out of the Senate? I know it's speculation at this point.
I would imagine that it would be slightly different or maybe a bit more moderate. But the truth is, it's probably still going to end up with a lot of people losing health care. So from my opinion, that really doesn't make it better. Like we were talking earlier, 23 million people losing insurance versus the original estimate of 24.
Yeah.
That's still too many people.
Yeah, it's a lot of people.
I'm a bit more optimistic, or I shouldn't say that you're pessimistic. There are organizations like Rise Up Mystic springing up all over the country because people are finally coming to realize that writing a check to their favorite organization every once in a while is just not adequate. That civic action is absolutely essential. And
which is part of the reason it didn't pass the House the first time, because so many people thought it was terrible.
Yes.
So they modified it enough to get it through, but still it's terrible. And I think the Senate has had a lot of pressure because they talk to constituents too, and constituents are upset.
Sure.
well, and the House is very gerrymandered. So congressional representatives, especially in the more conservative parts of the country, have to worry
Can do
about
anything.
somebody coming into the primary from the right. And that happened enough times to make them really scared. And so they don't really have to pay attention to the Democratic population centers like New York and LA and San Francisco. But every city has a significant urban base and minority base that's not going to put up with these shenanigans for too much longer. So senators have to worry about the votes of the entire state rather than a gerrymandered district. So I'm hoping that that'll temper some of their zeal.
Yeah. And they really they can't afford to lose too many senators on the Republican side because there's almost an even split. So
Yes.
if a couple of senators don't go with it, and some have already indicated they can't go with what they've got now, so hopefully that'll temper it.
Especially states that have expanded Medicaid. That's a pretty tough sell to
That's a lot
anybody
of
who
people to
expanded
be
Medicaid
yelling
in
at
their
you.
state. Exactly. And it's been good for industry as well, for the whole healthcare industry. Hospitals who usually would go uncompensated for uninsured folks are now getting paid. And that's a hard thing to go back to your state and say, I took all that money away.
Yeah.
So hopefully that will also make some senators rethink that decision.
Yeah.
And they need to be reminded that many of the initiatives that liberals now are trying to defend against the Trump administration were initiated under Republican administrations,
Right.
like Nixon's HMO Act and the EPA.
Yeah.
So if Republicans can kind of look back at their history, and Teddy Roosevelt with the national parks, hopefully they'll moderate their views.
That's traditionally both parties have tried to govern. We've had sort of a variation of that now, where the Republicans kind of believe in non-government. They don't like government, so they kind of prove that it doesn't work every time they get in charge. So that's my feeling about that. Do you have any other suggestions on what we could do to fix Obamacare that would actually make it better and maybe make the Republicans even happier?
At this point, over 50% of the population support the type of insurance, regardless of name. And as they see it fading away, there'll probably be more of a call to save it.
Yeah.
And if people can spend the time to educate themselves in terms of the various elements and how they all depend on each other, and be willing to fund it, particularly with taxes on the ultra-rich, who are going to be the main beneficiary of blowing up Obamacare,
Yeah.
and let them vote
There's
with their
many,
wallet.
there's
and
many
their-
that believe that is the reason they're trying to change Obamacare, is because of the tax part of it. They want to give taxes back to the rich, and that will help them with their tax modification plan as well, because they started at a lower point, fewer taxes. So it's a lot about the money.
Sure. I mean, but I think it's always worth writing to your representatives. At Rise Up Mystic, we've been organizing events like that now since January, and it always helps if we're in a blue state here, but to remind them that they're fighting what we want them to fight for.
Blumenthal and Murphy are both doing a great job.
Exactly.
And they're partly doing that because they know they've got a lot of
Yes.
support out here in the hinterlands.
So
that's good.
always reinforcing that, and I would say right now the main goal would be to keep Obamacare as it is, and then once that's once that scare is passed, then hopefully we can work to make it better. I don't think anyone would say it's a flawless bill, but it doesn't deserve to be completely scrapped and trashed without giving it a fair chance or funding it appropriately.
Yep. Making it better would be better.
Exactly.
And if viewers would like to write letters, our representatives would like to hear concrete stories of
Yes.
how Obamacare has allowed them to sleep at night, has helped provide quality, affordable care to their loved ones. And pretty much everyone has somebody in the family who has had a serious illness. And something like half the bankruptcies in this country are due to medical issues of people losing their job, losing their insurance.
Yeah.
And
It's a huge part of the economy. The medical part of the economy is a huge portion of it, and it's all interrelated. Like
Yeah.
you mentioned that everything is connected, and so you can't tweak part of it without consequences. And I hate to think we're going to wait till the consequences are really bad and then realize, oh, that wasn't a good thing to do. But
well, Trump-Ryan-Care will give companies that have been traditionally very supportive of their employees, some of the largest companies in the world, some of them headquartered in Groton, will give them the opportunity to start cutting back.
yeah, that's something that's not well known, that this actually will affect all kinds of insurance, not just Obamacare and the subsidized insurance. It's going to connect.
Yeah.
It's going to influence what's offered to anybody.
Every
Anywhere.
single American is
Because
is
they're
at
given
risk
the
of losing
option to
something.
insurance companies and to states and everybody to do what you want. And
Yeah.
that's dangerous because no one wants to do anything extra if they don't have to. That's traditionally.
And to just add to that, part of what the Congress is ultimately trying to do is to apply some of the same principles of tightening on entitlements to Medicare. So Medicare is far from secure. And President Bush already tried to go after Social Security,
Yep.
and there'll be more attempts. So
Cuts in, the SNAP program, commonly referred to as food stamps, housing subsidies, and I can't emphasize enough how much those types of social determinants, we call them usually, influence health. So people who don't get regular meals and who don't have a place to live or sleep, they are at much greater risk for health-related issues. So not only are they cutting the Medicaid and the insurance programs, but they're also taking away a lot of these other social supports, which are just going to really exacerbate the problem. Study after study has shown that is an incredibly important part of somebody's overall health and well-being.
Well, we have zipping through a half hour here. I thank you both for participating.
Thank you for having
Maria
us.
Petrillo, active with Rise Up and can be contacted. Come to a Rise Up meeting.
Absolutely.
Dr. Eugene Winchester, we
Well,
appreciate your,
thank you very
your
much, sir.
sharing with us and helping us sort out this complicated issue, because it is complicated, and I think the more people know about it, the more they will realize it's not just a simple fix and a simple solution, because there are consequences.
and to do their own research, to
Yep.
get past the headlines and educate themselves of what it's all about and what they stand to gain and what they stand to lose.
Well, you're both an inspiration. Thank you very much. I'm glad you came, and hopefully someone else will see this and be inspired too.
Thank you.
Thank you all for tuning in for another serving of Potluck Politics. I'm Peter Roper, urging you to be involved, and especially now, stay well.